Safe administration of medicines. Introduction to the module. The process of administering medication can be separated into two parts: preparation, for example, dissolving soluble pills or making up a solution using a syringe, and drug delivery, by any route. There are formal or informal careers to administer medication taken at home: spouses, parents, children, nurses, or care assistants. The remaining administrations are performed primarily by nurses or care assistants in hospitals and in institutional settings such as nursing or residential homes. Learning objectives. After completing the module, you should be able to get an overview of the health professionals whom you can rely on medication administration. Realize the key principles of safe medication administration. Find out errors during the administration of medication and the factors behind of them. Figure out medication administration errors, (MAEs), in the nursing home setting and patient's home settings. Who can administer medication? The following employees are permitted to administer medications if they have completed the required training and have been deemed competent: a registered nurse, a registered medical practitioner, a registered pharmacist, a registered pharmacy technician, a registered nursing associate, physiotherapists under the direction of an authorized prescriber and where it has direct relevance to a specific therapy. After passing the Trust's Medicines Management Competency Assessment, appropriately qualified and registered bank and agency nurses will be hired. At the discretion of the ward or departmental manager, healthcare support workers who have achieved NVQ Level 3 or higher and are deemed competent following proper training, assessment, and frequent supervision may help in the administration of the drugs mentioned below. Application of topical medicines. Installation of ear or eye or nasal drops. Inhalers or aerosol devices. Oral medicines excluding controlled drugs. Epileptic fit rescue medicine, Children's Division only. Oxygen, Children's Division only. In the best interests of their patients, healthcare support workers must follow NMC guidelines for the administration of drugs. A named registered nurse will, in all situations, be held liable and accountable for the delegation of such tasks and any acts performed by a healthcare support worker operating under their authority. During their adaptation period, nurses in training, including a return to practice students and overseas registered nurses, are subject to the supervision and accountability of another registered nurse. The supervising, a registered nurse, is responsible for ensuring that the medicine is correctly administered. Nurses in training must not use the intravenous method, unless to replace infusion bags without additives, or deliver medications via pump. Patient, to themselves. Key Principle and 7 Rights of Medication Administration. Key Principle. Every authorized person who administers medicine to a patient must be aware of the patient's assessment and satisfied that the drug and dose are appropriate for the patient. They must also know the therapeutic uses of the medicine, its normal dosage, side effects, precautions and contraindications. 7 Rights of Medication Administration. Understanding drugs and how to help people use them is critical for the health and well-being of those you serve. The best approach for a direct support professional, DSP, to avoid medication errors is to follow the 7 rights each time you assist someone with self-administration of medicine. 7 Rights of Medication Administration. 1. Right medication. 2. Right patients. 3. Right dose. 4. Right time. 5. Right route. 6. Right response. 7. Right documentation. 1. Right medication. Always double-check that you're giving your patient the correct medication. Giving the incorrect prescription is a concern in and of itself, let alone the possibility of triggering allergies, causing negative side effects, causing unneeded symptoms, and having serious consequences. After establishing that you have the correct person, read the drug label and review the patient's charts to ensure that you are giving the correct medication. 2. Right patient. First and foremost, ensure that you have the right person. This may appear obvious, but any exhausted physician or provider managing a small number of patients can make such a simple error. Regardless of how long you've been in your sector, constantly verify several sources to ensure you're delivering medication to the right person. You can match the person's name on the drug label to any records you have, question the patient for their name, and have them confirm their date of birth. 3. Right dose. Along with the correct medication comes the correct dose. Administering the improper dose could result in an overdose, damage, or worse. The appropriate dose will be listed on the individual's file, along with the form of the drug, such as liquids to swallow, liquids by IV, or pills to eat. Doses will differ depending on the form. If something doesn't seem right, a change in form, size, color, or dose, check the dose information with 1 or 2 different sources. Even if it means delaying administration for a short time, you should be absolutely certain before administering medication to a patient. 4. Right time. In many circumstances, medications must be provided at specific times based on other medications they are taking, when they eat meals, when they last took the medication, and so on. This isn't always the case, but you should keep track of which prescriptions are and aren't time sensitive. When you give a patient medicine, you must keep track of it so that everyone helping you treat them knows when they last took a dose. To confirm when to administer the medication, consult the label and the patient's chart. 5. Right route. The term route in this context refers to how and where a patient takes their medication. Many drugs, for example, are taken orally. On the individual's file or on the medicine itself, there should be explicit instructions directing you to administer it vaginally, rectally, through the eyes or ears, through the skin, via the lungs, or another route. A nasal spray is for the nose, topical treatments are applied directly to the skin, ocular drops are for the eyes, and so on. However, you should avoid making assumptions. Always double-check numerous sources to confirm your assumptions. 6. Right response. The goal of administering medication is to convey a good response. Record whether or not the medication is working and to what extent, so that everyone caring for this person is on the same page when it comes to providing a solution as quickly and efficiently as possible. 7. Right documentation. You must write what you did after the medication has been administered in addition to confirming every step leading up to it. Multiple healthcare workers are most likely checking in on each individual patient at the same time, not to mention shift changes and other disruptions. This is why it's critical to document all you've done for your patients, whether on paper or electronically. Take careful notes on any missed doses, errors, side effects, interactions with other medications, and so on. Always include your signature or initials so that the report may be traced back to you if there are any queries or concerns. Subcategories of medication administration errors. Omission. Wrong dose preparation or preparation technique. Wrong dose or improper dose. Wrong patient. Wrong dosage form. Wrong rate of administration. Deteriorated drug. Drug incompatibility. Extra dose or unordered dose. Wrong time. Wrong drug. Wrong administration technique. Unordered or non-prescribed drug. Fast intravenous bolus. Wrong route. Wrong diluent. Factors contributing to medication administration error. Factor. Examples. Patient. Lack of difficulty with, or delays in waiting for intravenous access, absent or sleeping patient. Staff. Health and personality, fatigue, sickness or discomfort, stress, nervousness, inexperience, inadequate training, lack of knowledge. Working environment. Absence of policies or complicated or unsuitable policies. Insufficient equipment such as computers. Failures in communication such as illegibly written. Information and information not being passed on. Lack of supervision of junior nurses. Lack of skilled employees, heavy staff burden, end of shift or patient transfer pressure. Distractions and interruptions. Lack of medicine supply, logistics. Medication. Look-alike medicines, sound-alike medicine names. Medication administration errors, MAEs, in the nursing home setting. People admitted to nursing or care homes may have a greater risk of MAEs. There are several potential reasons for this. In general, such patients receive numerous medicines. A significant number of individuals may have swallowing problems, which can lead to medication manipulation that isn't appropriate. Many residents have cognitive impairments, making it difficult to participate in the drug administration procedure or alert personnel to potential concerns. Finally, They are more likely to experience adverse medication effects once an error has happened due to age-related pharmacokinetic and pharmacodynamic changes, as well as frailty. Certain types of MAEs seem to be more frequent in this setting. These include the inappropriate crushing of medications that should not be crushed, such as slow-release formulations, and the splitting of tablets that should not be split. Such errors may be more likely in the nursing home population because of a higher prevalence of swallowing problems. In the UK care home setting, researchers found significantly higher error rates for inhalers and liquid medicines than for solid oral doses. About half of all inhalations were given incorrectly, commonly involving not shaking the device before use, incorrect inhalation techniques, and the wrong number of inhalations given. Some reports showed that patient-related factors such as patients' unawareness of their medications and patient behavior as contributing factors. Other problems, such as a lack of staff and a lack of expertise regarding drug administration difficulties such as inhaler technique, were similar to those seen in hospitals. Other factors were related to failures in communication and a poor working environment. Lack of responsibility was reported as an organizational factor contributing to the error. Medication administration errors in patients' homes. Home healthcare is a type of medical care delivered to patients in their homes by qualified practitioners under the supervision of a physician. This might include administration by trained carers in a patient's own home or assisted living facilities. Small-scale studies in some countries would suggest there are high error rates. More research on these issues is needed, particularly given the trend toward more home care for the elderly and other patient groups. Medication-related activities are also increasingly being assigned to inexperienced home care workers. Highlights of the module. Every authorized person who administers medicine to a patient must be aware of the patient's assessment and satisfied that the drug and dose are appropriate for the patient. People admitted to nursing or care homes may have a greater risk of medication administration errors. Many residents have cognitive impairments, making it difficult to participate in the drug administration procedure or alert personnel to potential concerns. Some reports showed that patient-related factors such as patients' unawareness of their medications and patient behavior as contributing factors. Medication-related activities are also increasingly being assigned to inexperienced home care workers. Thank you. This is the end of this module.